फर्स्ट होची इरेगुलर पीरियड इरेगुलर पीरियड होची रेगुलर पीरियड होची 21 दिन रु 35 दिन एनीथिंग व्हिच इज नॉट लाइक दैट यू कैन कंसीडर एज इरेगुलर बहुत दिन चलला कम दिन चलला बहुत जल्दी जल्दी हला बहुत लेट रहला एवरीथिंग कैन बी कंसीडर्ड एज इरेगुलर सेकेंड सबुठु इंपोर्टेंट पार्ट होची हाइपर एंड्रोजेनिमिया रो फीचर्स हाइपर एंड्रोजेनिमिया माने सेटा गोटे मेल हार्मोन्स थाए टेस्टोस्टेरोन सेटा फीमेल्स मान को देहरे भी थाए जेमति कि मेन मान को देहरे भी फीमेल हार्मोन्स थाए so if that is in excess you find some symptoms like excessive acne व्रण body acne face acne hirsutism which is excessive hair growth some hair growth is normal all women if you see will have some kind of little bit hair हो कार बेसी कार कम फैमिली रे बेसी टेंडेंसी थाए नॉर्थ इंडियन मान करो बेसी साउथ इंडियन मान करो कम ईस्ट रे टिके कम थाए यू नो दी एब्नॉर्मल बट एब्नॉर्मल हेयर ग्रोथ वेदर इन द बॉडी मोस्टली फेशियल एब्नॉर्मल हेयर लॉस दैट इज कॉल्ड अ मेल पैटर्न तामने ए सामना रे बॉल्डनेस फीमेल मान करो यूजुअली पछपटे बॉल्डनेस हबो जदी जेमती जेमती ताकर एज हबो सो दिस इज कॉल्ड अ सामना फ्रंटल बॉल्डनेस इज आल्सो अ फीचर कि तम बॉडी रे प्रोबेबली अधिका testosterone achi other than that some other features are also there like acanthosis ekdam neck pigmentation a neck re mota mota pigmentation we hath guda kare 80 सब pigmentation so these are features which might indicate to you jadi e dita achi ki moro PCOS achi ki let me show to a doctor third aspect hochi ultrasound aspect but सेटा को importance दियनी कारण ultrasound तो तुमे करिवनी ना अल्ट्रासाउंड डॉक्टर जदि एडवाइस करिवो जदि सेथरे बाहरला पीसीओ टाइप रो मॉर्फोलॉजी अछि देन डॉक्टर विल टेक अ कॉल ऑन दैट बट ये जो अल्ट्रासाउंड रिपोर्ट दे दउचंती आ कहउचंती पीसीओएस अछि जाओ डॉक्टर को देखाओ दैट इज नॉट अ करेक्ट थिंग तो तादरे मोटे कैरिड अवे हबोनी अल्ट्रासाउंड रे पीसीओएस डायग्नोसिस हुए पीसीओएस डायग्नोसिस पई प्रथम दीटा कंडीशन दरकार जो दीटा then you have to see ki what happens in PCOS kon hobo apart from irregular menses unfortunately this is a lifelong problem it is a journey which you have to understand it's a cure hoboni and it can't be cured it has to be you have to learn how to manage it and at different stages in life there are different kinds of problems so let's say in early ages reproductive age group adolescent age group jemti mo कहली menstrual irregularities cosmetic माने व्रण acne ये से hair growth दे बहुत लोगों को ये जो छोटे छोटे भातुड़ी भड़िया बेकअप करे सब ऊपर दिए जाए acanthosis वे so these are cosmetic issues mental health issues बहुत हुए age group में because you know most of them are obese ठीक है मोटापाटा ता संगे associated है की ता संगे ये hair growth ये से सब एक लाल otherwise also young people are having a not young people every human today has a huge mental health problem and young people I think are suffering maximum with stress you will all agree I don't have to elaborate on that so mental health issues sleep issues बहुत जिनसे एक आउ कौन ही परिवो reproductive problems ही परिवो pregnant हवारे असुविधा increased insulin resistance I didn't say because it's a very medical term insulin resistance means the body is resistant to insulin they are highly prone to develop diabetes okay so insulin resistance is a part of PCOS that is why PCOS women get a lot of diabetes so infertility abortion chances अलगा pregnancy रो complication गुड़ा का अधिका later age रे obesity गोटे बड़ problem later age रे metabolic syndrome diabetes blood pressure arthritis atherosclerosis coronary artery disease cardiovascular disease cerebrovascular disease so the entire gamut of metabolic diseases PCOS women are more prone to get that and then at a later stage even cancer of the uterus fatty liver कहे को बोलिए non alcoholic fatty liver एगुड़ा का सबू part of the PCOS so गोटे PCOS women रो बहुत जिनस ही पाइबो again it's a spectrum समस्त को सब जिनस हबो बोली नाही you know with covid कहा को खाली नाकरू पानी बाहर छ किछि होनी के जाय कि ICU रे admission हे साला so similarly PCOS also is a spectrum so you have to understand that there are a lot of things that can happen next होची काहे की हबो PCOS what is the cause is very simple one is a genetic cause and one is a environmental cause Genetic cause तो तुम्हारे हाथ रे नहीं, कहाँ हाथ रे नहीं. It is something which you have got it from your ancestors, from your mother, from your grandparents, whatever, you've got it. But today, the environmental impact ta बहुत बेसी है. So this thing is now less genetic factor. That is why, because environmental impact ta इतने बेसी है that we are seeing such a lot of PCOS. नॉले सेती की PCOS genetics तो आगरू भी थिला. Genetics तो change है नहीं है. But environment ता इतने change है गलानी, lifestyle ता इतने change है गलानी that it has led to a lot of PCOS. And one of the major drivers, it are खाली to show you in a dimension, genes are there, but environmental and other causes have now taken the upper hand. Now, little bit of digression to make everybody understand that today there is a huge impact of lifestyle, environment and stress on human fertility and health for every disease. Do you know that this present decade and the next decades belong to cancers?
Yes.
Now, all the advanced countries have they have conquered communicable diseases. तांकर malaria, diarrhea, ये सब नहीं सब. तांकर blood pressure, heart attack, ये सब. आमे माने सही stage है. Now we will also conquer those diseases also. Diabetes is almost normal lifestyle, but now it is the time of the cancers. And why is that? That is because of the environmental huge impact.
Yes.
So you are having there is something called endocrine disruptors, jota tomorrow environment re achi, and those are chemicals that are entering through your food, through your water, through your air, through your mother's blood, even inside womb. There are different kinds of chemically active hormones that mimic chemically active substances, chemical substances that mimic your hormones. So jetale se mane body choti, they are affecting almost all the glands of the body, men and women, pituitary, hypothalamus, ovary, testes, pancreas, adrenal, and they are the ones that are causing havoc in today's day. As you can see, what are the suspected endocrine disrupting chemicals? They are there in pesticides, household products, solvents, industrial ingredients, pharmaceuticals, metals, they are innumerable. So I am sure you all are aware of this. I just put 2 or 3 slides more to make you understand that these are also one of the causes why we are seeing an epidemic of obesity and PCOS. Obesity causing chemicals ko kahanti obesogens.
Okay.
So they are also causing a lot of, they're creating havoc in our body. And as you are aware, try to reduce chemicals from your household, use less fossil fuel, get rid of toxins from the body by sweating it out. Glass, steel use karo, ceramic use karo, eat fresh, local, green and organic. Go minimalistic on cosmetics, girls. This is one thing I love to tell, that ajikali mu kalina podno gote chiote tama sangre asla 12 ବର୍ଷ 12 years. Trust me, ଏତେ dark lipstick ଲଗେଇ କି ଆସିଲା ମାନେ ମୋର ଖାଲି ଇଚ୍ଛା ହଉଥିଲା କହିଦେବା ପାଇଁ, ମା ସାଙ୍ଗରେ ଆସିଲା ତ ମୋତେ ଇଚ୍ଛା ହଉଥିଲା ତା ମାଆକୁ କହିଦେବା ପାଇଁ, କିନ୍ତୁ ଆଉ କହିଲିନି. But you see, go low on cosmetics, and at least young children. It is because you are eating them and they have a lot of colors and chemicals that can cause a lot of problem. So go as low on cosmetics as possible. Now, quickly in the next few slides, I will show you what are the associations of PCOS, and then few slides to see how they can be treated. Now, PCOS and obesity are very much linked. Obesity ta PCOS करेनी, किंतु obesity PCOS रो सब symptoms को aggravate करे. If you look at PCOS women, 80% are obese, but PCOS रो ଗୋଟେ lean variety भी अच्छी, एकदम पतला, but severe PCOS. But obesity is a large part of PCOS women, and that aggravates a lot of problems. And you know why there is obesity. I don't have to tell you. Because of poor lifestyle and eating junk food. As you are aware, one of the first things that you can do is to have carbonated, sugary drinks. And it seems 300 ml of Coke has 40 grams of sugar.
Yes. Diet Coke भी जीवन में
Diet Coke has chemicals which are even worse. I keep telling everybody, please तमे sugar खाई की diabetes रे मरो, किंतु sugar substitute खाई की cancer रे मरो. So cancer, the sugar substitutes are even worse. And you have to understand the difference between abdominal fat. सबुठु metabolically active fat which is abdominal fat. So a shape like a pear is much healthier than a shape like an apple. It is the waist fat which matters. Your waist has to be much less than your hip. You should, generally that is where the bad fat lies. So that you have to understand that central obesity is the most, and we as Indians, as Asian Indians, have a serious problem with some genes in our body that predisposes to insulin resistance and abdominal fat. Our lokomane, they might conform to normal BMI. BMI mane body mass index. Ami gote patla dekhi na patla loko. Kichi problem nahi. Kintu taro abdominal obesity. So that is makes it bad. And second thing we have to understand ki our loko bahut sarcopenic. Tankara muscle nahi body. Because we do zero exercise. ଆମର ଏଡିକେଟ୍ କି ପିଲା ବି ଯେତେବେଳେ ସ୍କୁଲକୁ ଯାଆନ୍ତି ସେମାନେ କେବଳ ବଲିଉଡ୍ ଗୀତ ଦେଖି ନାଚିବା ଛଡ଼ା ଆଉ କୌଣସି ଜିନିଷ ଜାଣନ୍ତି. There is no push on sports and physical exercise. So our people are, they may be normal in weight, they may be thin. In fact, by all means, all standards they may be thin, but they don't have muscle in their body. If they don't have muscle in the body, then the risks of metabolic disease are extremely high. Okay? So now, PCOS से कौन metabolic comorbidities है? So one is obesity. Yes. Second is metabolic mu sabu बतेली, diabetes, blood pressure, cardiovascular disease, eating disorders, bulimia and anorexia. I hope you know what is bulimia and anorexia. एगुड़ा को eating disorders. माने mentally stressed up ही गले भूत खाई देवे, फिर जाके बातें करिए. आओ फिर भूत stressed up ही गले किसी खाई भी नहीं. एकदम काठी भर जाइए. So there are certain medical conditions. They are more common in PCOS. Depression, anxiety, very common. Endometrial cancer, sleep apnea, sleep disorders both way, and because of obesity, neither way नहीं भलो ना. Sleep apnea हुए, माने neither से पढ़ले, निश्वास टा बंद हो जाए, निकल फिर बंद. That's called it's a. Third होची PCOS and menstrual disorders and fertility. कौन थी परिवार? Irregular cycle, missed period, मास धरी की period होगी. 7 मार्च 8 मार्च लेका period. आउ जदि irregular हो माने प्रति 15 दिन रे ही जो. Delay in conception, increased rate of infertility, miscarriages. PCOS women are somehow more prone to have abortions. जदि भी pregnant है गले, abortion हमारो टिके न को अधिका chances है. There are various reasons are increased insulin resistance and others. Most problem ताकरे यह हुए जे ovulation पे. As you are aware, all women who have a regular cycle, ताकरो पूरा मास सबो मास में गोटे लेखा egg release. If the egg is released, menses comes in time and they are fertile. See, आखिरी पाखिरी से माने pregnant ही पड़े. So ovulation पेनी बोली, they are less fertile. Apart from that also they have many other, because they have increased male hormones. They have other issues also, fertilization भलोकी पेनी, implantation हेले pregnancy, abortions अधिका हुए. एक patient माने जदि IVF दरकार पड़े ताकर IVF रा success rate भी टिके नको poor थाए अन्य patient मान. And fertility रे अलगा issues जैसे pregnancy related complications, pregnancy रे diabetes, pregnancy रे blood pressure, pregnancy रे large for date babies, माने बड़ो size babies, increased chances of cesarean section, yes. Obesity रे complication. So all these things are likely more in PCOS women who are getting pregnant. Fourth is PCOS and dermatological issues. I told you they suffer from many dermatological issues, acne, body acne, hair growth, abnormal hair growth. देखो एक रकम को acanthosis कोथली, एटा कम को जो कोथली, बहुत रकम skin tags हुए. They are all indications of insulin resistance. ये सब जिनिस थिबो बोले future रे केबे ना केबे definitely in diabetes हमारो संभावना अच्छी. Then frontal baldness, various degrees. So these are some skin issues that one faces. Mental health and sleep issues, disorders. एटा भी बहुत common है, like I was mentioning to you. Stress is a major part. हमारा वो stress questionnaire था, आपको PHQ 9 काउंटिंग. So सेटा हमें मु usually सबो PCOS from my center I have one of the largest series of PCOS publications in the country. बहुत publications our center रू हुए. So we keep a record of our PCOS girls and women who come in. समस्त को गोटे PHQ-9 बोली गोटे questionnaire दिया जाए. That studies the rate of mental health stress. So you'll be surprised to see कि सेटा देखी कि ना after looking at those questionnaires, depending on what they have answered, ମୁଁ ସେମାନଙ୍କୁ ଦେଖି ଯଦି କିଏ ଗୋଟେ ବହୁତ high stress level reply କରିଛି, then I refer them to a counselor. You'll be surprised, PCOS women, I think almost 90% reply with a very high score of PHQ-9, which means that they go through a lot of mental health. There is a lot of body image issues. I look like this, I have hair like this, I look bad, this, that. So body image is a major issue for young people these days in the world of the social media. So seta gote mane all the time they are looking at perfect people, perfect figures, perfect people, and that is a very big problem which leads to mental health issues. And then so I think these 5 things are the major problems that women find with PCOS, and this is a lifelong journey. Okay, now last few slides to tell you as to what is usually done for treatment. Now treatment re first thing is lifestyle changes. जो भी stage रे PCOS patient आसिबो, first thing होची lifestyle changes. Lifestyle modification is regarded as the first line treatment of PCOS, and by lifestyle we mean 4 or 5 things. Increase your activity. तो आजकल पेशेंट मान को कहवा ही छाड़ दी चीजें एक्सरसाइज करो. एक्सरसाइज ना सुन देले ही घबराई जाओ. So I tell them कौन कोटे करो which is your activity level. हम activity level ले आजकल ही कहले. घंटा के ना 10,000 steps तम होल्ड रे करो. तुम्हें घरे ये पर सब वो सीढ़ी चढ़ो ये करो से करो. योगा टिके सीखो. तमरो प्राइम मिनिस्टर योगा कोची कौन कोचती तमें योगा सीखो. So something like that which increases your activity level. Your आजकल ये Apple Watch रे अच्छी कि 1 hour more than 1 hour if you're sitting it's prompting you get up it's 1 hour that you're sitting. So something like that. So you increase your activity levels, and of course second part is about changing your diet. Dieting fighting बोली जिनसे नहीं. There should not be a word called dieting. There's no question of dieting. One has to change their diet. And when we say change your diet, it means avoid environmental contaminants, endocrine disruptors, obesogens. एयुराको निजे पढ़ो, देखो, सीखो, and try to change on them. So these two, and then I tell them that sleep habits have to be perfect. Every human being needs 7 to 8 hours of sleep. Deep sleep, REM sleep, जो sleep रे dreams आसे, that's called a REM sleep. So every individual needs REM sleep every night. That is the best healing process for the body, and it needs to be done in the night. Not that tinta जाए चाहे कि ना reel देखी लो, and then जाए कि सोई लो सकाळ 10 बजे. So that defeats the purpose.
Yes.
That completely defeats the purpose, because you have to understand when the body, let's say, is awake at 2 o'clock in the night, what message is it sending to your brain? It is sending a message कि तुम्हारो कौन तो गोटे problem थी वो राती 2 टा तो कहीं चाहते नहीं. ये काहे की राती 2 टा रे चाहे कि बस यार कौन गोटे serious problem अछि. So adrenaline is getting secreted. All these stress hormones are getting secreted because the body is getting ready for flight, for managing any unforeseen circumstances.
Yes.
So that is the message that is going to the body. The minute stress hormones are rising, adrenaline is rising, that is leading to increase in male hormone levels, which is called androgens. That is leading to a increase in estrogen levels, and the entire cycle, circadian rhythm सहित people don't understand that, because you're not supposed to stay awake. There's something called your body clock gets activated with the sunlight. That is what one needs to understand. Yes. So these are a couple of things, and then I tell them about devices, social media. So these are the lifestyle changes. But lifestyle changes koribo kemtia? When your life is starting like this, how will you make lifestyle changes? Tell me. And look at this picture. It seems Albert Einstein said, I fear the day technology will take over our humanity. The world will be populated by a generation of idiots. And then this is for our country. ଆମ ଲୋକ ତ ଛିଡ଼ା ବି ହେଇପାରନ୍ତି ନ୍ୟୁ ୱେ ଟୁ ଷ୍ଟାଣ୍ଡ ଇନ୍ ଦ ଲାଇଫ୍ ନିଜର ଜୋତା ରଖିଦେଇଛନ୍ତି and this is my most favorite. Archaeologists will find this kind of skeletons after 5,000 years. से मरीची भी यही अवस्था कानरे गेंजीची हातरे स्मार्टफोन धरची and that is how it is going to happen. So how in this kind of a world, how are you going to make lifestyle changes? How do you expect young people when the children are, this is what they are seeing and this is how they are growing up. And the worst part is that they are having a very unrealistic idea about lifestyle and weight. Look at this video. This is a video for a vacuum machine. So, one has to understand that lifestyle is not about weight at all. Everybody has their own comfortable weight which God has taken. It's supposed to be like that. Yes. It's not about weight. It is about emotional well-being. It is about quality of life. It is about looking into depressive anxiety disorders, psychosocial problems which young people face so much these days. They're so confused about what's happening in the rest of the world. It's about body image issues, about sleep disorders, about eating disorders. खाली जॉन को खाली कह दो तो बहुत मोटा ही हो तो खाया बंद कर। ही जो की you have to understand first place से खाऊची खाई क्यों दिखा? So and weight issues are there, but then it's not about weight loss. So we have to find easier methods. Have a look at this video. ଯେତେବେଳେ ଛୁଁଛି ତାକୁ ଶକ୍ ମାରୁଛି remember the diet. So the point is that you have to find easier ways.
Yes.
These methods can't be adopted. You have to find easier methods if you don't want to, So you have to probably understand and find that some cut sugars, carbohydrates, at least 500 calories. These are very technical things. I don't want to bore you by saying all these things. But the point is that behavioral strategies, goal setting, self-monitoring, time spent with the virtual world, sleeping habits, these are more important. Khali kahi dele haboni. And I think what young people or people who are trying to be healthy need to understand, just focus on abdominal fat and physical activity. Don't bother with weight loss. You have to not eat stuff that causes petare obesity, and you have to be just physically increase your activity. And this is a fabulous saying which I love. Food is the most abused anti-anxiety drug. ଟିକେ tension ହେଇଗଲା कि कौन गोटे achievement ହେଇଗଲା चलो खाइबा हमर तो इथे किछि नाही टोटल आउ किछि एक्टिविटी ही नाही आज बर्थडे अछि चलो खाइबा आज एनिवर्सरी अछि चलो खाइबा आज कौन क्लास रे फर्स्ट डे चलो खाइबा आउ किछि देयर इज नथिंग एल्स एंड व्हेन यू आर एंशियस तो ऑफ कोर्स खाइबा and exercise is the most
chocolate is the mood elevator
advertisement भी सेमती छाड़ो छथि and exercise is the most underutilized antidepressant यदि के try करिवो if they just walk quietly for half an hour 1 hour early in the morning or sometime even late in the night, just walk around quietly. That will be such a fabulous anti-anxiety. You can sort out a lot of things, and it will cause a lot of okay. So I think I can all these things There is no magic diet and all that. Protein khao, fiber khao, all these things you are very, very much aware. Now that was about lifestyle. Second was about fertility. Almost 70-80% of PCOS women suffer from infertility, but that is easier to treat. बहुत जो माने बहुत टेंशन ले थाती हमर छुआ पिला होनी हमर PCOS है that is one of the major concerns. But I think I can assure you that largely it is very much treatable. Mostly minimum treatment रे काम चली जाए. Lifestyle changes, some drugs are there, medication हल्का अच्छी ovulation करेवा पाई. जन को टिके ovarian drilling दरकार पड़े बहुत कम पार्ट maybe about 5-10% need ovarian drilling, another 5-10% need intrauterine insemination, and even smaller need IVF. But there are good number of treatment options for women of PCOS who are not getting pregnant. There are many choices that they can take, and it is not a very big problem. And finally, apart from the gynecologist, which because I am a gynecologist, I have put those two conditions, many other specialists are there who can manage issues like skin issues for dermatology, psychological counselors, psychiatrists, dietitians, fitness experts, and endocrinologists. Is ସମସ୍ତଙ୍କର help नबाकु पड़े to deal with the multiple problems that come with PCOS. But it is not something for which one needs to be harassed or worried too much. Mostly it can be managed, but girls need to understand that they have to understand the disease and learn to manage it. And it's not something that can be cured very much. So thank you very much. I would also take a word to thank our president, Dr. Durisha. She's the president of the PCOS Society, and it is an entire efforts by which she is, delegated work to people like me in the society, and we are propagating her cause for creating more awareness for PCOS. So I hope it was useful. I am happy to answer whatever questions you people have.
Yes. अपन चेयर नहीं होगी possibly question answers नहीं करेंगे
Okay.
question काफी अच्छी
Okay.
अच्छी काफी ये देवर तो you coordinate your questions clear यार करो विचित्र क्या तो उठाई था तो so anybody has a question we have to create stuff
What is the difference between?
and you tell your name first then tell the question
My name is Aishwarya Mishra,
Okay.
and I want to know, like you said, in between deep sleep and REM sleep. And in REM sleep, we used to get some dreams like of things. So can you please explain it elaborately?
So when I said you should sleep for 7 to 8 hours, I wanted everybody to understand that sleep la maleta kaun. It's not just because sometimes sleep can be very, very disturbed, and that doesn't help. So what I meant is it should be good sleep. By good sleep, sleep has various stages. You don't need to understand that. There is superficial sleep, and then stage 1, stage 2, then REM sleep, and then you go back. There are multiple cycles of sleep that you go through. So what I meant to say is that it should be good deep sleep. ता पाई कि ना जो मन को difficulty हुए, they have to really try to understand and get over it, and learn how to get good sleep. Otherwise दिनों जाकर काम नामा करी आले अरे ये गले तो जो ही एकदम घोड़े बेच के सोने की तरह सो गए.
अगर हम सोते हैं नींद अच्छी आती है तो काफी है.
Yes, काफी है. All sleep will be like that.
नहीं मतलब सपना नहीं आने से भी चलता है.
No. Remember, 99% of your dreams you don't remember. Listen, you're not supposed to remember your dreams. This is brain's way of going through your entire activities, your stores, whatever is stored in your brain, and develop your memory and help in rejuvenation. So you're not supposed to remember the dream. Sometime once in a while you may remember if you suddenly get up in the middle of a deep sleep. Otherwise, you're not supposed to remember. एमती नहीं जे sleep next day भाबिलो स्वप्न तो किसी नहीं असली. That means you're not supposed to remember your dreams. That is how it is. Rahile bhalo, but you're dreaming all the time. Every night everybody is dreaming. It's part of sleep. It's part of sleep physiology. बहुत कम मने रहे.
PCOS के लिए मेडिसिन भी लेते हैं, है ना?
हाँ.
तो वो क्या कंटिन्यू करना चाहिए या बंद कर देना?
It depends on क्या प्रॉब्लम है. Because like I said, बहुत कुछ प्रॉब्लम हो सकता है. So कौन से प्रॉब्लम के लिए मेडिकेशन ले रहे हो? It will depend on that. That doctor will advise you, and mostly I think इस situation में so इस situation में the thing you have to understand is that you should do regular follow up. हर साल में एक बार follow up होना चाहिए डॉक्टर के साथ, so that you will understand कि next मुझे क्या करना है, same medicine continue करूँ नहीं करूँ क्या, like that.
मैम और क्या हैं मतलब वेट मतलब लॉस होने से उनका सब ठीक होगा मतलब
नहीं सब ठीक होगा तो मैंने नहीं बोला
नहीं मैं पूछ रही हूँ
नहीं सब ठीक नहीं बट आई थिंक लाइफस्टाइल चेंजेस के साथ
हाँ
almost 40-50% of the problems can be kept at hand and things can be kept at a minimum whatever complaints you have but like I said it's a very heterogeneous disease ना which means किसी को 100 लोग एक रूम में होंगे PCOS के सब अलग अलग सबका कंप्लेन अलग अलग so it's a very heterogeneous disease.
So, madam, what is drilling of the ovary?
Ovarian drilling is a procedure. It's a laparoscopic procedure in which
That कौन कामोड़ा कौन हुए?
कामो होची जे that reduces the intra-ovarian male hormone levels. Just androgens जो थाए ovary गुड़ाकरे भी multiple follicles ले जाए.
हाँ.
So that is the appearance of polycystic ovarian morphology. Ultrasound is empty to say. So drilling करके स्ट्रोमा बोली गोटे पार्ट थाए हाँ स्ट्रोमा बोली गोटे पार्ट थाए ओवरीरो सेटा बहुत सिक्रेट करे मेल हार्मोन्स so by drilling it you are putting about some 50 watts of cutting current
okay
into the ovaries and burning some part of the stroma of the tissue that is secreting the male hormones thereby reducing the male hormone levels and hopefully improving the symptoms some symptoms of PCOS.
very nice ଏବେ ତମେ କେବେ ସବୁ ମୁଁ ତ ଦେଖି କରୁଛନ୍ତି ovarian
Madam, ଆଉ ଗୋଟେ question.
ହଁ
ଧରନ୍ତୁ weight reduction ହେଲା with a thorough disease with after 3-4-5 years she lost weight and all so after that she gained weight so again it will reoccur
Because the disease is not going
it will
anywhere.
reoccur
Disease is not going anywhere.
stays.
So and also when we mean lifestyle changes, one has to make attempt to keep maintain that for the life. So like I again said, don't bother to look at the weight. अगर lifestyle टा ठीक करें ना से यदि जड़े regular habit नहीं रह जो जे exercise is part of my life.
Yes.
Work being actively part of my life and in my eating habits I don't eat too much carbohydrates I don't like to eat too much sugar once in a while natural sugar नहीं पारे मु coconut sugar हला गुड़ हला ये गुड़ा तो then it's unlikely that I'm going to put on weight no so जहाँ भी changes कोई बार अच्छी that's for life then only it means lifestyle changes नहीं
मैडम इतने genetics ର କିଛି ନାହିଁ
genetics तो बहुत अच्छी मु कहली genetics टा main part so PCOS समस्त को तो हुएनी समस्त जो माने मोटा ही जाती समस्त को तो period problem हुएनी समस्त को fertility problem हुएनी so this is a different disease and definitely genetic is a component genetic is it's a component से पे होची PCOS but because से माने और ये बहुत weight भी बढ़ी गई lifestyle टा भी बहुत खराब हो जाती से पे এটা बहुत aggravate है माने धरो जो menstrual irregularity अपन धरो ଧର ଗୋଟେ ଝିଅର menstrual irregularity ଏଇ 30 ଦିନ ବଦଳରେ 40-45 ଦିନରେ ହଉଛି କାମ ଛୋଡୁଛି ବଟ୍ 7 ମାସ ହବନି 8 ମାସ ହବନି 6 ମାସ ହବନି then ତ ଚଳିବନି ନା so that is what obesity is doing that is what bad lifestyle and bad food is doing yeah
मैम गोटे दिन रे हमें केते सुगर नेबे
सेमती तो किसी भी नहीं but if you go by WHO standards maybe 5 to 10 grams which means 2 teaspoons
2 teaspoon 2 cup chai
see actually sugar ଆଜି ପର୍ଯ୍ୟନ୍ତ ଯେତିକି substances ଅଛି sugar is the most addictive unfortunately human beings understood that late smoking ବିଷୟରେ ବୁଝିଗଲେ alcohol ବିଷୟରେ ବୁଝିଗଲେ drugs ବିଷୟରେ ବୁଝିଗଲେ cocaine ବୁଝିଗଲେ they are very addictive but if you look at it sugar is even more addictive sugar ଛାଡ଼ିବାଟା ବହୁତ difficult and sugar ରେ ଏତେ harm ବୋଲି ଏତେ ଦିନ ପର୍ଯ୍ୟନ୍ତ ଜଣା ନଥିଲା everybody thought sugar is fine now also we think sugar is fine nobody thinks it's such a bad thing
but now they are compulsory with jaggery and now they try to compensate with jaggery
yeah that is why now the recommendation is छुआ को first 2 years 3 years of their life मोटे sugar को introduce ही करो so that they don't understand that value of sugar ଆମର ତ କଲଚର ଗୁଡ଼ାକର ଅଛି ଆଟଲିଷ୍ଟ ମାରୱାଡ଼ି ମାନଙ୍କ କଲଚର ଛୁଆ ଜନ୍ମ ହେଲା ମାନେ ଆଗ ମହୁ ଚଟାନ୍ତି. So we have not understood, but sugar is actually most addictive substance. And now we know that it is harmful. It is the new smoking.
Okay.
That was 10 years back, when sugar was the new smoking. Today, sitting is the new smoking.
Okay. Okay. सीधा कोई कोई everybody is sitting.
So in some offices and some places, like people who are becoming aware that they're talking about standing desks. My daughter-in-law were working, she's working in Cambridge. They have the concept of standing desks. They have the concept of taking meetings, walking. So these are some changes.
But now you understand why your pantry doesn't have chairs. At least in pantries we have done this.
Okay.
There's no chairs.
Okay.
They can stand and eat.
Yeah, yeah.
ठीक है जी ना?
Any questions? मैम कभी कभी क्या होता है कि मान लो कि आज टुडे डेट इज 18, तो इट्स December 18th. ओके, सो ऐसा भी होता है कि January 18th को ही नहीं 15th या 14th को हो जाता है, नहीं तो कभी कभी 25 के आसपास भी आगे पीछे भी होता है पीरियड्स का. तो ये क्या है?
मैंने पहले में ही आपको बताया, याद भी होगा. Anything, any period that is from 21 days to 35 days is considered normal.
Okay. Okay. Good.
That I spoke first, you must have forgotten. 21 से 31 days का cycle, any 35, that is considered normal. And in any case, कोई महीना 40 दिन हो गया, ऐसे हाइपर होने का जरूरत नहीं है. You have to watch it for 6 months, 1 year करीब देखा. Then you maintain a menstrual calendar. I think साल में 12 बार नहीं होके, अगर 10 बार हो रहा है, it's fine. 9 बार हो रहा है, फिर भी it's okay. 6 बार 7 बार is a little less. So you have to watch for some time. Only then you'll know what kind of menstrual.
ତାର ପଚାରିବାକୁ ଅଛି ନହେଲେ ମୁଁ
ପଚାର, please.
Actually, not of myself or my sister, about my grandson.
Okay.
He is now 12 years old, but he has dark band backside of neck and on the thigh, dorsal surface thigh, and here only. So what is that symptom? What it?
No, I can't say that. It could be just a birth. I'm not sure what it is.
मैंने उसको डॉक्टर देखा तो मैंने वहाँ पर पुणे में पटना में दिखाया, बोले कि ये मतलब हो सकता है कि बाद में उसको डायबिटीज हो सकता है.
If that is called acanthosis. Is the child obese?
A little bit obese.
Okay. Then and parents have diabetes.
Till now not yet diagnosed.
Okay. Yeah, if it is acanthosis, it is a feature of insulin resistance and must be because of obesity. Obese hele, but এটা କହିବାଟା ଭଲ ହବନି, ମୁଁ ଜାଣିନି କଣ ପିଲାଟା ଦେଖିନି.
But in girls,
no, men and everywhere this neck re pigmentation हबाटा, velvety type ro elevated ହେଇକି pigment हबाटा, that is a sign of insulin resistance for anybody. माने boy हो girl हो.
but not the symptom of PCOS.
No. It is a symptom of insulin resistance. It's a sign of insulin resistance. एमती भातुड़ी गुड़ा का भी sign of insulin resistance.
Ma'am, after 40 years, ovary ଆମେ ଯଦି remove କରିଦେଉଛୁ, ତା ପାଇଁ କିଛି hormonal କିଛି problem ଆସିବ କି?
माने को गोटे मेडिकल कारण ପାଇଁ remove करा हला ovary. हाँ problem आसीबो. माने menopause ହେଇଯିବ 40 ରୁ. लॉन्ग टर्म रे बहुत प्रॉब्लम्स हबार चांस अछि. सो डॉक्टर डिसाइड करिवे दबा पई जदि दरकार हार्मोन रिप्लेसमेंट दबा. प्राइमरी प्रॉब्लम हबो ऑस्टियोपोरोसिस. सेकंड प्रॉब्लम हबो कार्डियोवास्कुलर डिजीज. Females are protected by their hormones by females ମାନଙ୍କର हार्ट अटैक कार्डियोवास्कुलर डिजीज काहे की कम?
Protected also.
Because of estrogen.
Yes.
Because the women are supposed to live longer. In nature, God has universe has made it such that women are supposed to live longer because they are the ones who will propagate the species.
Okay. But we
So
said the same
all
this, na,
advanced
after-
societies, there are women will have a longer life than men. It is only in countries where the value of women is less, like India, Bangladesh, Pakistan, where you will have, there are less number of women and their lifespan is shorter. Otherwise, women live longer than men.
But at around 52 to 54, we share the same risk.
Yes,
as men.
after that the risk becomes same. Because after that menopause regular hormones structure. So after that the risk becomes almost similar.
Sure.
So if I stroke halika risk karike body. So
Yes.
ম্যাডাম মেনোপজ পরে বর্ষে 2 বছর পরে something like that irregularity কিছু কিছু জনগণ হচ্ছে
এটা বড় problem.
then what is your advice?
So that is a totally different set of
না
problem.
PCOS
So postmenopausal bleeding. देखिए कि next steps को पड़े. That's a big problem. So one has to exclude cancers.
Ma'am, we have not used the word thyroid problem analysis for this infertility in women. Is the thyroid problem is related to this infertility and PCOS?
It's not related to PCOS. Maybe related to infertility, but we are talking about PCOS, no?
So that is not related to this PCOS.
Which means if you have thyroid problem, do you have PCOS?
Yes.
No. It's not related at all.
That condition is exactly what? That means the ovary
Polycystic ovary syndrome.
syndrome. Okay.
Ovary को भूल जाओ.
Huh.
Its name is a misnomer.
Hmm.
The problem is irregular menses,
Hmm.
increased male hormones.
Okay.
And by chance, when you have a scan the ovaries, they look like that. They look like polycystic ovary. But that is not a diagnostic, not much diagnostic importance. So এই দুটা হচ্ছে মেন। আজকাল তো মানে I am really very whole day ভিতরে ব্যস্ত লাগি যাଉଛି এতে they are so common. I mean period होनी कार 7 मास ହେଇନି 8 मास ହେଇନି 6 मास होनी ନହେଲେ କାର ଚାଲିଛି ମାସ ଧରିକିନା ଚାଲିଛି period so and right from so young age obesity level is so high.
Yes.
And that is why menarche is also earlier now. Menarche means onset of menses. Onset of menses is expected to be around 12 years, 13 years. Even also considered
9 years.
So obesity and environmental contaminants are to be blamed.
I think cosmetic that they are going there, everybody is putting on now. You see, cosmetics is a very much part of our lives. What do you go out with? Liner has to be there in my eyes, lipstick has to be there on my lips.
I agree
Hand
with
for
you.
a smartphone in my hand, then I move out. That's up to everybody. Nobody will deny here.
I agree, including me.
We experiment a wide variety of brands also. So how do we do that? वो तो करेंगे या कैसे करेंगे उसको हमारे शॉप पर समझ नहीं आ रहा how to minimal stick with you know there's a brand now minimal stick they have given a brand also
Other than reduce is what I would say.
But
And
ma'am,
reduce
how
the
it
one
affects
by one, reduce.
to the
Because they're colors, they're synthetics, they're chemicals.
they get inside
That get absorbed into your body. Everything including shampoo, ସବୁଥିରେ ତ parabens ଅଛି and they are endocrine disruptors. PA, parabens, all these are extremely harmful to the system and we didn't really understand that, no?
long time
Long time.
अभी भी नहीं है पूरा
अभी भी पूरा
अभी वो ये तो बोल रहे ऑर्गेनिक दे रहे हैं इसमें कुछ नहीं है एकदम ऑर्गेनिक चीजें लगा लो है ना ये enhance
So see, if women stop paying too much importance to that,
हाँ
It might, but then it's an industry. It is industry driven. Like food is industry driven. Food by if the government wants, they can make it extremely easy for people to avoid. For example, 20 ଟଙ୍କାରେ ଗୋଟେ ସେ ମ୍ୟାକ୍ ବର୍ଗର ମିଳୁଛି. Can you imagine? In fact, there are countries who started putting tax on obesity. They started putting tax on this kind of food. So if these kind of foods will be more expensive, people will not use na. ଏବେ କୋକ୍ ଫୋକ୍ ଦୁନିଆ ଯାକ ସେମାନେ ଶିଖିଗଲେ. ଯୋଉଠୁ ଷ୍ଟାର୍ଟ ହେଲା ସେ ଶିଖିଗଲେ ଯେ ଏ ସବୁ ବହୁତ ଖରାପ, ଆମେ ଏବେ ଖାଲି ପାଣି ପିଇବୁ ଆଉ ଏଗୁଡାକ ଲଦ ଥର୍ଡ ୱାର୍ଲଡ କଣ୍ଟ୍ରିଜକୁ.
ସବୁ ସାଇଜରେ ମିଳୁଛି.
And third world countries से ଆମ ଲୋକ ଏବେ ଏଟା ନୂଆ ଦେଖିକି and cheaply and ଖାଲି ନାଟା ସିନା କୋକାକୋଲା ଅଛି, ତିଆରି ତ ହଉଛି ଏଇଠି ତମ ବାଡ଼ିଆଡ଼େ ନା. So you can imagine, it doesn't taste same, it's not same, it has a lot of bad stuff and people didn't realize it for a long time. ସେମାନେ ଏବେ they have started putting a lot of taxes on these things. Supposed to be, they should be more costly than other things. ଆମର ଗାଁର ଲୋକ ଆଗରୁ ସେ ଯୋଉ ପଖାଳ ଖାଇବା ଲୋକ ଏବେ ମ୍ୟାଗି ଖାଉଛନ୍ତି, ଚାଉମିନ ଖାଉଛନ୍ତି.
Now water is more expensive than Coke. You buy a bottle of water for 50 rupees, but you buy a Coke for 20 rupees or 10 rupees. That is more cheaper.
Yeah. And those multinationals are only laughing their way to the bank. ଆମର ଲୋକ ଏଠି ଡାଇବେଟିସ୍ କମ୍ପାନୀ ପଶିଛନ୍ତି, ଗ୍ୟାଷ୍ଟ୍ରାଇଟିସ୍ କମ୍ପାନୀ ପଶିଛନ୍ତି, ସେଇ କମ୍ପାନୀ ମାନଙ୍କର ମେଡିସିନ ଖାଇ ପଶିଛନ୍ତି. And now it's cancers. So big health problem for India, very big health problem. ଆମେ ଯେତେ ଦାମ ଦେଖିକି ଖୁସି ହେଲେ ବି health is a very big problem. Diabetes ଟା ହିଁ ଦେଖୁନ.
ଏବେ ତ I am liking it, you know, because of this parks all around. ଆପଣ ଦେଖିବେ every park ବାହାରେ ସବୁ ଛତା ଦେଇକି ସବୁ ଦଉଛି ମାନେ ହଳଦୀ ପାଣି, ଏ ପାଣି.
Yes, even I saw that.
I like
ଏ ଯୋଉ କଣ କଲରା ଫଲରା ଦଉଛି,
amla ରସ ସେ ବଢିଆ ହଉନି.
people are
They are doing that is very nice. I think even amla juice ଟା ଦଉଛି, ସେଇଟା actually that is a big blessing to the society, I feel. ସେ ବସୁଛି ସକାଳୁ ପୁରା
but ଲୋକ ଜାଣିକିନା ଖାଇଲେ ନା ହବ. ଲୋକ ସେଇ
ଅନୁସାରେ ଖାଉନାହାନ୍ତି, ଖାଉଛନ୍ତି ଯେ
ଯୋଉମାନେ aware ହେଇଯାଉଛନ୍ତି doing it. But overall,
Tanmay is not here. Tanmay ko just he has 10. He put 10 on July 22nd. Okay. After that, he has to really make a fundamental lifestyle changes for himself. But I see the last 3 months, not only he reduced on weight, his face is now glowing. His has become better. Looking younger. नहीं कहते लोग को agree करचो? We have never thought it completely has changed. बहुत pattern है. माधुरी देखती हो, है ना? जो पूरा changes हो जाएगी. तो वो सेटा देखिए, I was also so inspired. ये देखो, look how the whole thing has changed. There is lot of, I think, still hope for all of us.
There is a lot of hope.
But another thing I saw in your presentation was the belly fat. Actually, that is the most
important.
It doesn't go away ऐसे भी जल्दी से यार.
It's very difficult to go because it's visceral obesity. It's inside the abdomen. And Indian people are very prone to it. Yes, Southeast Asian actually. South and East Asian people, we have a genetic abnormality that predisposes us for abdominal fat.
Okay.
And see, we all think कि भाता में सब बहुत खाऊचे and all that, but look at people in Japan. They are rice eaters, rice and fish eaters, but their shape and all is so good. You look at French and Italian people who love to eat pasta and spaghetti and noodles.
Yes.
But look at them.
Yes.
So our तो ठीक है genetic problem अच्छी. On top of that, we have our people are not physically active. ଆମର କାମ ଦାମ ଆଉ physically କାମ କରିବାର culture ନାହିଁ. That is the problem.
How many of you are going for a daily walk? Raise your hands, sir. कितने जन सब जाऊँचे मुझे क्या है? कितने जन जाऊँचे थी? Oh, nice. ममता जाऊँगी नहीं ममता.
But I would say for these young girls, walk to 70+ लोग walk करो.
हाँ
ये पिला गुड़ा कौन walk
जॉगिंग जॉगिंग
jogging
दौड़ना
करिए.
दौड़ना चाहिए
Heavy माने heavy exercise करिए.
ଭଲ ବି ଲାଗେ if you run you feel very good ଟିକେ ବି ବେଶୀ ନାହିଁ short term run କଲେ ବି ମାନେ only Shrikant could muster strength to come rest of the guys didn't come my god देखो तो आप कौन नहीं କରିବା କହିଲେ I was the they are feeling ଝିଅ ପିଲା କଥା ତ ଆମେ ବି